Good afternoon, everyone. Thank you very much for joining our traditional live Q&A on Friday afternoon. My name is Dr. Elena Klimenko. I'm an internist and functional medicine practitioner in New York City. And today we dedicate this time to a very dear topic, dear to not just me, but many participants in this call and many women, and you learn why, and men as well. And what is it, menopause? We're going to talk about it and how to help our women to thrive during this natural process. So with that, we can just move forward. And many of the women who come to my clinic will come with this variety of different symptoms. It could be a brain fog, or they're losing the ability to multitask. They've been on top of their game, and all of a sudden things just crashing, and they don't understand why. It usually corresponds with or coincides with missed periods, or the periods becoming more irregular. They start getting hot flashes or night sweats or some other strange thermal reactions throughout the day. And they start complaining of the dryness everywhere, dryness in the eyes, dryness in the skin, in the hair becomes more unmanageable, and also vaginal dryness, of course, and joint pains. Never had any joint pains before. All of a sudden, overnight, they started aching, paining, not just in the joint, but also in the muscle. Mood swings, inability to hold the stress or be resilient to a variety of the stresses, just keep piling in our lives, and at the same time, sleep troubles. And of course, there's a lack of libido, lack of connectiveness or connection to our loved ones. All those changes that we see could be due to the menopause, especially if it's happening during the time when menopause is so common. So, depending on your age and the symptoms, you might be experiencing the symptoms because you're either perimenopausal or already menopause. So, and that could be happening for different women at different times. And as we know now that women spend anywhere from third to half of their lives in menopause. That's a long time for women to go through this and experience those symptoms. And some women can experience those symptoms for 10 years before, even during the perimenopause. So for some women, perimenopause will last for 10 years. So how can we help these women to thrive? And today we're going to talk about menopause and perimenopause, what's happening with our bodies during this transitional time. We're going to mention a few words about what is the conventional approach to treatment of menopausal symptoms, as well as functional medicine approach that is so much more comprehensive. And we're going to talk about our program that we developed for our women who are going through this transition so they can be well equipped and understand what are their bodies going through and what are those changes related to. So let's start with the definition. You might be perimenopausal if you're in your 30s to 50s. So we actually know that the age of menopause is heavily determined by the genetics. So the best predictor of women's menopause is their age of their mothers entering the same period. However, we now see more and more that women entering perimenopause younger and younger. So anywhere from 30 years old, when women start experiencing the variety of those symptoms that I just mentioned, basically involving every system in the body, they could be going through the hormonal changes. And by age of 50, majority of the women usually entering menopause. But it can last for 10. And so some women will still continue to get their periods. They might be irregular or becoming more irregular. Sometimes they start skipping it, but it's still all in the perimenopausal period. And some women can have all those symptoms that I just mentioned, involving all the organ systems, but still have their period, but yet having hormone imbalance that's worth to talk about and address. So when the women entering menopause, the definition of that is more of the absence of the period for more than 12 consecutive months. So if month 13, no period, menopause. But the age should be definitely around 45 to 50. That's the normal range of their menopausal changes and when women entering menopause. So again, the same symptoms that we just mentioned on our on the previous slide that outlines variety of the organs and system involved. The why women go through such a dramatic symptomatology when they're going through their hormonal changes. Well, as you probably know, women and men have those sex hormones. And estrogen and progesterone, even though they're present in male body, they're present in their very small quantities. When for women, those are the two most dominant hormones. The estrogens are present in a variety of the fractions, and one of the most dominant is estradiol, which is explained by two oxygen groups. That's why it's diol. But we also have estron and estriol, which is determined by the number of oxygenated groups. And the progesterone is another hormone that actually plays the dance with estrogen throughout the cycle. So as we go through the menopause, both of those hormones drop slowly but progressively and become basically almost non-existent. This is their cycling of the hormone in the normal menstruating woman. As you can see, the cycle is anywhere from 27 to 30 days. This is just an average 28-day cycle. And as you can see, the estrogens depicted here in pink fluctuates and go high in the middle of the cycle when we ovulate, then they drop, and then we have another hump right before the period. With progesterone, that as outlined in the green, their cycling happens in a very different manner. And as you can see, it goes steadily low in the beginning of the cycle. And as we're entering after their ovulation, when the body's preparing for possible pregnancy, progesterone becomes dominant hormone. So as you can see, women are pretty complex creatures in their hormonal balancing. And that's what explains variety of their issues and symptoms that women experiencing through their cycling life when they still fertile and still childbearing age, but also they missing this cyclical secretion of the hormones in the perimenopause. Why? Because during the perimenopause, all these that are their dominant hormones producing the estrogen and progesterone basically retire. They slowly but surely shrink and do not produce any more hormones like they did before. So ovaries are their pair glands that are located in their pelvis and on both sides of our lower abdomen. So they stop producing the hormones, and as a result, we start experiencing all those symptoms that I just mentioned. So this graph actually shows the relationship of their symptoms with estrogen level. So you can see as the estrogen level remains relatively high and stable during our perimenopause, we experiencing less symptoms. However, in our 30s and 40s, as the estrogen levels start dropping, we entering the perimenopause, and that's where we start getting much more symptoms that is depicted here in red. And as the hormones fluctuate but steadily going south, we can see that the symptoms become stronger and stronger until our body adjusts to that low level of hormones. And from the last period until their official diagnosis of menopause or permanent cessation of the periods, we entering the postmenopausal age. And for many women, it's in their early 50s. But as I mentioned, we see that women entering this period of life younger and younger. And as I mentioned, many of us will live third to half of our life in this state of low hormones. And of course, No hormones contributes to more morbidity, more diseases, more chronic illnesses, as well as shorter lifespan. So what women say to me is that I don't know what happened, but I thought I know how to handle my body. I know how to manage my diet, my exercise, my routine. I thought I had a great grasp on how to manage my stress. And yet everything has changed. I didn't change my diet. I still continue to exercise, but now things change so much and I don't know how to explain it. And all these changes causes a lot of symptoms. So many women, even though they understand, they don't recognize that the majority of their symptoms are related to this hormonal imbalances. And all those hormones, especially estradiol, the estrogens, impact every system in our entire body. Definitely every system and almost every cell in our body, because every cell has estrogen receptors, except for few. So as you can see, estrogen plays a very important role in function of brain, in function of heart, in bones, joints, digestion, our immune system, of course, our mood because of the brain, and our skin. And if we don't have that estradiol impact and stimulation of every cell in our body starts shrinking. Our brain shrinks, so we lose our memory. Our heart is not performing as well, and that's why the cardiovascular diseases rate increases as women entering the menopause. As I always said, that we are protected by Mother Nature with estrogen up until the point when we stop getting that estrogen, and that's when our rate of cardiovascular disease actually equates to male rate of heart disease. We lose our bone mass, we develop osteoporosis, we start aching, the joints become drier, so they're not replenishing that cartilage and synovial fluid. Our digestion is sluggish. Estrogen actually affects our microbiome. So our digestion starts suffering, immune system becomes dysregulated, we become much more prone to a variety of illnesses, our mood becomes really difficult, and skin becomes wrinkly, dry, and aging faster. And we're losing our hair, of course. So what can we do in functional medicine to kind of prolong our longevity and prolong our youth and support our body through this inevitable changes? Well, as you can appreciate, with the majority of this great amount of the symptoms, conventional medicine does offer treatment. Well, here's the pill for your depression, or here's the pill for your anxiety. Oh, you don't sleep. Let's give you a sleep medication. Or yes, it's definitely the symptoms related to your hormonal imbalances. So how many women come to me on birth controls in their 50s, but not for their contraception purposes, because they just the many doctors know that, oh, this is replenishing the hormones, or they're blocking their own hormone production and overimpose the synthetic birth control pill hormones. Oh, let's put the IUD, or let's maybe some advanced doctors would consider hormone replacement therapy, but there is a lot of myth about hormone replacement therapy because of the previous studies. And of course, therapy is very useful, and I have nothing against the therapy. I think many people, and women and men, should grasp the benefits of talk therapy, especially if there's any issues related to past experiences or current discordance in relationships. So that is their conventional treatments. Well, with functional medicine treatment, we always start with the diet, right? So the diet is your biggest impact of on health. One of the biggest therapeutic intervention that you can imagine, because you eating 2-3 times a day, that's when you send a signal to your body about is it going to be a healthier stimulation or impulse or unhealthy. Unfortunately, conventional medicine does not include sufficient amount of education, and I am always very happy to see that more and more doctors and healthcare practitioners seeking the education, but it's not much in conventional setting where doctors can learn about variety diet so they can guide their patients efficiently. Movement. It is so important for us to continue to move. And with menopause, the movement's actually changing. Instead of being a running buddy and doing cardiovascular that a lot of women prefer to do in their childbearing age, they need to start shifting their focus on weight bearing and on weight lifting. Stress management. Yes, indeed, with the drop of the hormones, especially progesterone, we become much more sensitive to the stressors and our resilience drops. And that determines also sleep issues. So definitely variety of the sleep techniques and stress management techniques are very important in our overall approach, in our system of helping women in the transition and teaching them the right way of living their life in a new state of a menopause. And then it would also include variety of their evaluation. We do need to change to do a set of labs. If you had your labs done 12 months ago, we need to repeat it again, maybe even 6 months ago. We need to repeat it and do it more extended because we need to see all different hormones. We need to look at the thyroid, adrenals, not just estrogen and progesterone and testosterone. We're also looking at the genetic testing because if we talk about hormone replacement therapy, we want to know what are your genetic predisposition, not just your family history of present or absence of the cancers, but also looking at how you metabolize certain toxins as well as estrogen and progesterone. That's becoming really important for safe hormone replacement therapy. We do prescribe supplementation to reduce overall level of inflammation as is inevitable with the drop of the hormones. And finally, we do prescribe bioidentical hormones. But again, it's not our first line therapy. We do reserve it for proper candidates. And now finally, I would like to present a case of Connie. Connie is one of probably my most typical patients. She's 52 and she came complaining of the brain fog, sudden over the last 10 months, weight gain, 15 pounds out of nowhere. She didn't change her diet. She didn't change her exercise routine. She became a very poor sleeper and reports that her anxiety is definitely out of control. She used to have regular periods, and now she hasn't had period for the last 10 months. So she's approaching that period of the menopause. But right now she's still in perimenopause. She used to be a great multitasker. She was running a big medical practice with a multiple practitioners, but now she feels like she has to write down every little task that is coming her way. Otherwise, she doesn't remember all those things, and she's having a hard time to multitask. She feels lack of connection with her partner, definitely no libido, more anxious, less motivated to do anything. And even if she gets 8 hours of sleep, she wakes up in the middle of the night with the hot flashes and restless and thinking about her job. And unfortunately, even after sufficient amount of sleep, she doesn't feel refreshed. So what's causing all these symptoms? As I mentioned, yes, the drop of the hormones, not only estrogen, progesterone, but also other hormones that are kind of in their tangle with our sex hormones, cortisol, thyroid. All that proper evaluation is so important to help women to go through these changes. Right. We also found that the change in the microbiome increases the risk of anxiety and risk of indigestion and other symptoms. And also, because of those changes, women usually in menopause increase their risk of insulin resistance. And very commonly, they notice their cholesterol is going. Again, all those changes related to lack of balanced hormones. And many of us notice that the weight loss efforts become very ineffective and inefficient, and mitochondrial function or lack of such will create lack of energy. So what did we do for Connie? She basically entered our 6 months program to address multiple components of her hormonal changes. We definitely discussed her diet and improved her diet. We helped her to manage stress. We guide her for the better exercise changes and supporting sleep and blood sugar, which were elevated in her case. We tested her hormonal status with the blood and saliva. We usually use not only conventional blood tests, but also some functional medicine specific labs that help us to evaluate the tissue level, not just the blood level of the hormone, but the tissue level. Those being either saliva or urine tests to look for hormonal metabolites. And we also prescribe certain supplements to help with the blood sugar dysregulation, cholesterol, improve the sleep that is so essential, not only for mood and anxiety control, but also for the stress. And finally, we can start with the hormone replacement therapy. We use bioidentical hormone therapy that is either conventionally prescribed, can be obtained from the conventional pharmacy, or compounded pharmacy when we need to tweak and create a customized prescription for the patient. And patient, basically, Connie, after that reported that she not just dropped her weight 7 pounds in those 6 months, but she also started noticing improvement in her sleep, in her mood, in her anxiety level. Her work became much more manageable, unlike when she came to us. Joint pains improved, and that's very common that women experience a lot of aches and pains, and once their hormones are balanced, they feel significantly better. So this is just one example of our SOS stress recovery program. Unfortunately, or fortunately, we discussed menopause in our stress recovery because that's what almost 95% of women going through. They go through this really significant brain changes and mood changes. And during this evaluation, we do a very detailed history and create a timeline for women to connect the hormonal changes with their symptoms. And as I mentioned, could be up to 10 years before they drop the period that women start experiencing those symptoms. We do a lot of questionnaires for us to understand better what other possible reasons when women can experience beside the menopause. We're ordering the testing. We do prescribe lifestyle supplements, diet, and we always engage our patients into the self-education. So there is some resources for homework that always offered for our patients to understand either why the certain diet was prescribed to them or why certain testing is recommended. So because the functional medicine is always the partnership between client and the doctor. And follow-up appointments will be depending on testing that we are implementing. But most importantly, our patients are supported with the health coaches. And so each patient has an individual health coach who will be communicating on a regular basis, conveying their addressing some questions from the patient, as well as conveying my instructions that might present in the middle of in between the appointments. And so if you're interested to become a patient of our practice, feel free to scan this QR code and fill out your wellness questionnaire and see how you test in the questionnaire. What are the areas of imbalance that might exist right now? And then book the discovery call with one of my staff, or just pop into one of our live Q&A so you can speak with me directly. We usually schedule those at least once a month, sometimes twice a month. So just keep an eye on our notifications. You can subscribe to our newsletter or follow us on Facebook or YouTube, and to keep yourself informed about upcoming events. And as a gift for my beautiful women and men who are present here today, we're offering this stress relief bundle that you can get from my e-store and get 50% off because holidays should be celebrated by women and men, and why not to get a little discount on the product that you need to feel better? And this bundle includes the great protein shake with that I call best breakfast with the multivitamin, as well as the B complex, which is the activated B vitamin complex, and my favorite, magnesium, that helps us to sleep and detoxify while we sleep. So feel free to scan this QR code or just go on my website and go to the store and use this code MOM15RELIEF for 15% off. As well as I mentioned, a lot of women will start experiencing cardiovascular risk once they enter menopause. So we do want to protect our women from heart attacks, which are not poorly recognized in conventional setting. So please remember your antioxidants in the form of these fabulous greens and super omega 3 fatty acids that are so anti-inflammatory and help to reduce the inflammation not only in the vessels but also in your joints. And of course, another bundle to help with the gut integrity, and super omega 3s. Exactly, use the same code to get this generous 15% discount. So what is your next step? If you're interested to become a patient, please schedule a discovery call or call us, or just stay tuned after this presentation so I can answer your questions. Follow us on Instagram, sign up to our newsletter. We usually publish a lot of interesting information for people who are interested in healthy living and longevity. And just few announcements for those of you who are already a patient of our practice. We are expecting another series of HeartMath series training for patients to train their heart rate variability and coherence of the heart and brain. The classes will take part on the May 22nd and 29th. And those are the free classes with the purchase of their device that you need to master that technique. We might not have the 3x4 this month, but most likely next month we'll have them. And of course, we're open for referrals. So if you have friends who are looking for a good doctor, feel free to refer to